This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine your heart is a tiny, super busy pump, and every single beat it makes is controlled by electricity. But to actually squeeze and pump blood, the heart muscle cells need a secret helper. That helper is calcium. Think of calcium like the ultimate key that unlocks a muscle's ability to squeeze. Inside the heart cells, when a wave of electricity passes through, calcium rushes in, grabs the muscle fibers, and helps them snap together for a strong, solid contraction. Calcium chloride is basically a massive, fast-acting dose of those keys delivered straight into the bloodstream. What it does, the mechanism of action. When paramedics give calcium chloride during an emergency, they are trying to do two main things. Supercharge the squeeze. If the heart is beating incredibly weakly, adding extra calcium helps the heart muscle cells grip harder and pump blood more effectively. The ultimate shield. Sometimes, other dangerous things are floating around in the blood that mess up the heart's electricity. The biggest troublemaker is usually potassium. If potassium levels get way too high, it acts like a glitch in the software, slowing the heart down until it stops. Calcium doesn't lower the potassium, but it acts like a protective shield around the heart's electrical system, keeping the rhythm stable while the team works on the underlying problem. When paramedics use it, clinical applications. Because calcium chloride is incredibly strong, paramedics don't just use it for a normal heart attack. They save it for very specific, life-or-death cardiac emergencies. 1. High potassium, hyperkalemia. This is the most common reason. If a patient has a condition, like severe kidney failure, where their body can't clear out potassium, it builds up. Paramedics look at the heart monitor, see specific glitchy, warning signs, like dangerously wide electrical waves, and give calcium immediately to protect the heart from stopping. 2. Overdoses on specific heart medications. Some people take medications called calcium channel blockers to manage blood pressure. These drugs work by partially blocking calcium from entering cells to keep the heart relaxed. But if someone takes way too much by accident, their heart relaxes so much it can barely squeeze or spark an electrical beat. Paramedics flood the system with calcium chloride to overwhelm the medication and get the pump moving again. 3. Cardiac arrest. In special situations, if a patient's heart has completely stopped beating, calcium chloride isn't given automatically to everyone. However, if the paramedics suspect the heart stopped because of too much potassium or a calcium medication overdose, they will give it during CPR to try and jumpstart the muscle's ability to contract. While it's handled with extreme care, calcium chloride is tough on the body. It has to be given into a clean, patent IV line. If it accidentally leaks into the surrounding skin tissue instead of going straight into the vein, it can cause severe tissue damage. It's a powerful tool that requires sharp skills to use safely.